land. On the call today, we have Dusty Paez. She is our Director of Outreach at the Woodlands campus. And I'll introduce her in a second, but a little bit about Fusion Academy is we are a fully accredited private school. We serve 6th through 12th grade, and we are one-to-one personalized education. So every single class is one teacher to one student. And we serve those students where the traditional school environment just isn't the right fit. It could be due to high anxiety, depression, ADHD, or other reasons if they just need that flexible schedule. We offer full-time credit recovery and tutoring and mentoring. So I'm going to hand it over to Dusty for a second. Thank you.
You're muted, Dusty. There you go.
Hello, everyone. Hello, Dr. Ron. I'm so happy to be a part of this. Thank you, Brooke, and thank you, Dr. Ron, for having me. I've heard so many wonderful things about this series, so I'm super excited to be a part of it. And Brooke said it all, everything that we do and at Fusion Academy. And I would just mention that summer is just around the corner. So if you know any students who need credit recovery or want to work ahead, we are there and ready to help you at Fusion with our flexible scheduling being open from 7 to 7. Families really love that. And they can also flip over to a Zoom in case the student can't make it in that day. So thank you so much. If you have any questions for me and Brooke, we'll put our info in the little chat there. I'll turn it back to you. Whoever, you, Dr. Ron?
Well, next let's go. Where's Pam? Did she get in here? Okay, so we had somebody from the hub there. I saw somebody was in.
Hi, yes, Julie here.
Hey,
Hi,
Julie.
everyone. I'm Julie Pomerantz. I'm the Admissions and Outreach Director at the Hub Houston. And very quickly, I'll share with you that we have actually 4 different campuses now, 3 campuses, 4 programs. We have a school that we offer from ages about 13 on up. We have a young adult campus for ages 18 and over, which is called Life 101, which is our employability program. We also have our Club Hub, which is a social club that is offered 3 nights a week, 1 weekend day a month. And now we also have, under the auspices of the Hub, Aspire Accessories, which is the members are referred to as artisans, and they are also ages 18 and over. Basically, for all of our programs, we mostly work with members who happen to be on the autism spectrum, as well as those that might have anxiety, ADHD, medical issues, what have you. So everything we do is in very small groups, small ratio, and I'm very pleased to be here today. And I know that a group of our Life 101 members are listening in as well. Thank you so much.
Great, thank you, Julie. And I'm gonna turn it over to Miss Alexandra for us.
Hi, I'm Alexandra Roark here at the Houston Neuroscience Brain Center. We do EEGs to look for neurobiomarkers that could account for symptoms such as anxiety, depression, learning disorders, and more. And then based off of those reports, we can create treatment plans and protocols for neurofeedback training or therapy. And in addition to the neurofeedback training and EEGs, we provide therapy services and photobiomodulation. I turn it back over to Dr. Ron.
All right, great. We've got quite a few people in here so far. We've got 40 and we've got over 100 signed up. So they'll be getting copies of this tape. I'm Dr. Ron Swatzyna. I started the Houston Neuroscience Brain Center in 2019 in December. And we've been blowing and going ever since. We do try to be very research based, and we publish and present a lot of research. We've got several studies going on right now that are quite interesting. And we can get into some of those, but this is this topic today that we're talking about. Let me go ahead and share my screen and open up the PowerPoint. Is this it? Yeah. And blow it up. Okay. Minimize this. And this concept came up about 2 months ago. And I've got a great set of research assistants. They're over here in the back field over there. Say hi, girl. they, I said, we've been getting so many cases that had something wrong with them organically, whether it was something that would show up on their blood work, on their urinalysis, or on their tox screening, and it led us down a different path. And so, can anxiety, depression, and attention issues have an organic basis? Yes, definitely. And in the DSM, it states in there that you should always rule out medical causality for any of the presentation you see in psychiatry or psychology. So it's something that we have. I want to introduce you now to Miss Lori-Ann. Miss Lori-Ann is right here. She's a good friend, colleague, and spends every Tuesday morning with me and Dr. Rusty Turner, who's our neurologist, and we go over all these cases. And she's an up and coming little genius out here that does EEGs and QEEGs. And if you want to really think about what you want to do in life, is you want to hang out with people smarter than you, because you'll gravitate to the means of those around you. And so I got a lot of smart women around me, and it's tough keeping up, but I do my best. But and so she's going to help me present this, because we created this thing, and we're going to actually publish it. We decided, I asked the girls, I said, please start looking into all the physical symptoms, all the psychiatric symptoms, and all of the physical symptoms that go along with it, as well as we're going to look at what the causes of these abnormal labs are. And so I said, let's just limit it to what people can go and get a physical with, which we're talking about strictly their blood analysis and urine analysis. And so 2 months later, 31 pages into this table we have built, and we will be glad to share this with anybody that's registered as a Give Me. A lot of work went into this, but our plan now is we're going to turn it into an app. I've got a person on the schedule to try to take this data now and make an app. So if you have an abnormal lab, you just punch it in, it will tell you all this information about that abnormality in the lab. And even if you have a low normal or a high normal, if you're still experiencing the symptoms, those are just guidelines. That's where and we actually, again, want you to know who would be the appropriate referral for that. So let's go back to share the screen here. All right. So anxiety, depression, fatigue, impaired memory, poor attention, anger, and many other psychiatric issues can be caused by abnormalities identified in blood and urine tests. The way we're going to present this today is I'm not going to present the table. I mean, that would be boring. But what we're going to do today is we're actually going to present case studies that we've done, and when we found abnormal labs and what the ramifications of those were. This presentation discusses the value of lab tests for all experiencing psychiatric issues. Doctors, MDs are really not that good at explaining abnormal labs or low normal or high normal labs, and they really don't know the psychiatric presentation. I went to my cancer docs and I talked to them about this, and they want the app as soon as possible because a lot of their meds really do cause psychiatric issues. And so we haven't got those included in there, but what it does to the blood, what it does to the body and everything else is part of what you're going to see. For all that attend this webinar, as we said, we'll be providing a PDF copy of the most common lab abnormalities or presenting psychiatric symptoms and appropriate referrals. All right. Why lab results are so misunderstood. The normal ranges differ between labs. I don't know if you guys have ever noticed that, but through our research, it depends a lot on the collection method and how soon before you collect, from the time you collect, do they get to the actual lab to be assessed. So if they're put overnight into some sort of refrigerated box and then picked up the next morning, that's going to be a different set of normals than if they've got the lab in-house and they can take that blood right straight to the lab and have it analyzed. What's the difference between the normal ranges and optimal ranges? There is some studies out there, and I've tried to make this simple because it doesn't matter. If it's low normal or high normal or low or high, and you're experiencing the physical symptoms and the psychiatric symptoms or one or the other, you may want to get into the appropriate referral and see what can be done about it. Here lately, we have had a vast number of people come back with their vitamin D is all low. Well, we've been locked out of the sunshine for 2 years, 3 years, and that has become a habit. We can't hardly get the kids out of the house. They're not getting the sun exposure, so they have low vitamin D, and that does create a psychiatric presentation. In my decades of experience, never has an MD discussed psychiatric symptoms associated with normal labs, and so that's abnormal labs. So that's what we're going to do. All right, this was a case of a 17-year-old female that actually triggered this whole study. She came in to see me. I hadn't seen her in about a year since she went away to an inpatient treatment center in Utah. And when she came back in July last year, she actually had some lab work done, and I didn't put in what that is. Okay, this was a white blood cell count. She had a low white blood cell count of 2.9. Well, being in cancer treatment, I figured, I knew what the normal range was, at least for me, through MD Anderson. I said, oh my God, that's terrible. And she did present with, she had a lot of fatigue. A little 17-year-old lean little female should not be fatigued and have to take a 2-hour nap after school. She had pale skin, so her color was off for some reason. I made a comment about that, and anxiety, depression, and irritability. And I'm thinking, oh my gosh, low white blood cell count. So what do you do when you see an abnormal lab like that? Well, this was 6 months old, and it's like, due to the blood work being so old, that's old, not odd. Well, it was odd too, but old. We reordered the labs. And guess what? The white blood cell count, it was bad reading. There was no problem. But she did have low T3, so she had a problem with her thyroid. Accounting for the fatigue, the anxiety, and depression. She had low vitamin D, which accounts for lack of pale skin and lack of red blood cells. And she had these dark circles under her eyes. And she was homozygous for the A1298C variant of the MTHFR gene. And she only had 61% activity of their MTHFR enzymes. So the brain is a homeostatic system, and it uses neurochemistry to bring it back to neutral, bring it back to homeostasis. And in the MTHFR gene, that's not what this presentation is about. But if you can't process folic acid efficiently, you can't convert it to methylfolate. And if you can't convert it to methylfolate, you can't get it past the blood-brain barrier. And it's absolutely necessary for the production of serotonin, dopamine, norepinephrine, and melatonin. And a lot of children who have ADHD, we're getting ready to do a study right now. We're working with orthomolecular to see if we could do a study of about 50 to 100 children to see if the ones that have the MTHFR gene, we put them on a supplement for 3 months, and let's see what changes in their EEG. Do they and their ability to learn? So we're going to test for that, and their behavior. So it would be really amazing if we could fix the problem and not have to add a stimulant. So that's our goal. Second case was a 7-year-old male, and he was diagnosed with ASD, ODD, OCD, and bipolar disorder. He had an uptick in behavior over the last few months. Patient is suicidal. He tried to cut his throat with a knife, jump off a balcony. He also laid down in the parking lot waiting for a car to run over him. He lashed out and can be aggressive. He was kicked out of 2 kindergartens because he was biting people all the time, including teachers. And it's no longer safe for mother to watch him with her other 2 children. So really an issue. Mother was exposed to toxic mold during her pregnancy. So we sent him off to get a good set of blood work, sent him to a pediatric neurologist, Dr. Melissa Jones. And Dr. Jones found abnormal excess of gut bacteria and toxic levels of Roundup, the weed killer, in his brain. So apparently this boy had been exposed to Roundup. You see these commercials where people are spraying Roundup in their backyard on their grass to make the grass nice and pretty. Well, kids walk around in it without shoes on, and they get it on their legs and everything else, and it goes into their brains. What would have happened to this child if we had not have found this issue? It would have been put on some heavy antipsychotics and had a terrible outcome. And it was all because he had toxic levels of what we called in Vietnam Agent Orange in his brain. So it's it's definitely something that we wanted to find out. This was very critical in this case. Had a 7-year-old female diagnosed doing poorly in school. Houston Neuroscience Brain Center identified spikes over her left temporal region with slow posterior dominant rhythm of alpha. It's just EEG talk. We can explain that to later to those who don't understand it, but I put it in there anyway. She complains of pain all the time. I haven't seen this, but also diagnosed with precocious puberty. Her labs today showed high inflammation due to a living organism, virus, bacteria, or mold or parasite in her. Dr. Jones found this for me again. She had also low MSH and VIP, which further supports this. Her copper and zinc and ferritin are all on the low side. Unclear if this is impacting her cognitive function, but we'll correct with supplements. That's a note from Dr. Jones right there. And she's, again, what do we do when we find this stuff? We've got to know who to refer to, because this is outside of our area. We are not medical doctors. We are not trained for this. We're not functional medicine people. Let's give it to the proper person when we have these suspicions. But if you had some basic lab work, you got the key. Another case here is a 17-year-old female diagnosed with infectious mononucleosis, hypersomnia, abnormal EEG, chronic migraine, major depressive disorder, anxiety disorder, ADHD, and we want to rule out absent seizures as well. So this one went to Dr. Jones as well, and she found all this stuff. It really made a difference. The abnormal labs, we found the high findings of EOS, glucose, trans growth factor, beta-1, thyroid peroxidase. In our metabolic panel, we found all these other labs that were high in the high range and low CBC findings. Red blood cell count was off, the hemoglobin was off, the hematocrit was off. This is not a case for psychiatry. This is not a case for counseling. This is not a case for neurofeedback. This is a case where we need to get them into the right medical doctors to start working on this stuff. It may be at some time we can then come in and help her out, but right now you're not going to fix any of this stuff with the psychiatric medicine or with any sort of intervention that we can do. So again, another great case to look at to say, you know, this one, you kind of get the feeling when they come in the door and they've got all these issues going on. Ding, ding, ding. Have you had recent blood work? That should be the first question out of your mouth. Case 5, a 16-year-old male, medication was Adderall and Vyvanse, obviously diagnosed with ADHD, had an abnormal EEG, and it looked organic. I got this term, I tell pediatric neurologists, I said, it just looks organic. There's something wrong with this person's brain. Never come across this. Dr. Melissa Jones came back and she said he has very low cholesterol. His cholesterol, normally, she says the brain functions better around 200. His cholesterol was 20. And this is, the brain has to have cholesterol, you know, for the neurons, for everything. And so it's you know, she found also what's dysbiosis and gut, what? Leaky gut as possible celiac disease in terms of SIBO with high pathogenic bacteria. This guy, again, came in for ADHD, treated with stimulants, and the problem that created all this is that he had this low cholesterol, among these other things. So case 5, this is his creatine was low, his omega was low, his arachidonic acid was high, and his cholesterol was low. Is this yours?
This one's fine.
Okay.
Okay. So I'm going to present some cases that I saw. This first one is a 50-year-old female. She came into my office presenting with severe anxiety, and some of the physical symptoms that she had told me was weight loss despite increased appetite, increased heart rate or palpitations, fatigue, sweating, tremors, and also increased frequency of bowel movements. And when I was hearing her discuss this, besides feeling irritable and anxious, minus the weight loss, despite the increased appetite, all of those physical symptoms that she was reporting, seemingly seemed, yeah, it's anxiety. Okay, that's common experiences from people. When I looked at her EEG, it was had some abnormalities, and she didn't have any past medical history of any issues. So requested labs, and what we found is that her TSH level was really low. And that's not a typo. The normal values is 0.5 to 5, and hers was registered at 0.05 with elevated T3, T4. So she actually was found to have hypothyroidism with benign thyroid nodule. So when she started on her thyroid blocker prescribed for her physician, she reported better sleep, less anxiety, less irritability. And when she came back into my office as kind of a follow-up, I mean, she presented drastically different. So I'm thankful to have mentors and knowledge and my own experience with education about nutrition and working out to realize this was, again, just like the other cases Dr. Ron has presented, not a case that therapy would fix a thyroid issue. And luckily she was able to get the treatment that she needed. The next case was really interesting. She was an 18-year-old female patient presenting with depression. She was, I think, in the first semester of college, and she was athletic, but not training in something in particular. And when she came to me, she was reporting, particularly during the physical activity, shortness of breath, some chest pain. She kind of almost described it as like anxiety, but more so saying that the depression was an issue. I did notice pale skin. She was obese, and she had difficulty concentrating as well. One thing that didn't come up right away, but as a female and identifying as XX, she was also reporting issues with her menstrual cycle. When I looked at the EEG again, it was abnormal. And this seemed to kind of like all of a sudden come on in the last few months for her. She didn't report any other history of depression. So it was kind of interesting to figure out what triggered that. She said it was about in the last 4 or 5 months. We couldn't identify through therapy as something specific that would be indicative of that. So when I referred her to labs, what we found out actually is that she had life-threatening anemia. She actually had to be admitted to the hospital for blood transfusions due to the heavy flow of her periods that had been going on for about 4 months or so, 5 months. So that did kind of match the timing. But again, that wasn't the first thing she brought up in her therapy session. And then she was referred for more gynecological services due to that. So. The next case, 38-year-old female. This also was an interesting one. When she came to me reporting struggling with insomnia, irritability, anxiety, and also some impulsivity, which seemed fairly new for her. I put on there on the slide here, hot flashes. She didn't report actually hot flashes. What she told me was that in the middle of the night, she would wake up very warm, sweaty. And so it almost sounded to me like maybe it was an elevated cortisol level, which would flag what she was saying that, hey, I'm anxious, let's work on this in therapy. Later, when we looked at the EEG, we did see some beta activity at T4 that would correlate potentially to her impulsivity. When she also disclosed that there was a regular menstrual cycle, referred again to labs. And those were just some labs that we ordered. Those are pretty common for hormone levels to test. As a side note, which I guess we'll get further in toward the end, the lab ranges aren't interpreted by just the numbers, but also the relationship to those hormones to each other, which is why it's super important to have your physician analyze those and educate you about what those numbers are and what they mean. For this particular patient, she was diagnosed perimenopausal, which is actually pretty unusual. She's 38, and normally that tends to occur around ages 40 and 50. A lot of women aren't actually given the diagnosis of perimenopause or early menopause because it's skipped. Normally, they're going to the OBGYN when they've had 12 months or more without a period, and at that point, then they're diagnosed postmenopausal. Okay. This case, 23-year-old female presenting with depression and anxiety. again, you'll start to see a theme here of what my cases were kind of focused on is the menstrual cycle and some hormone issues, weight gain, hair loss, fatigue, dry mouth, mood swings. So kind of what you would assume someone who's identifying with depression, anxiety would be likely experiencing. However, in her EEG, we did see some transient discharges, which indicate that the brain is not functioning optimally in that particular area. Thank you. Ordered similar labs for her as well, slightly different with the testosterone. She ended up being diagnosed with polycystic ovarian syndrome. And typically the treatment, and for her, this did seem to be quite helpful, was lifestyle changes that promoted weight loss, diet, exercise. She was also prescribed a medication to help regulate the blood sugar. PCOS is really common. From my knowledge, it's 6 to 12% of American women who are in the ages of their reproductive ages. So this again was kind of a case that the labs were super helpful, and it is common with PCOS to have experienced depression. So obviously the therapy in that regard and working through that diagnosis was helpful. But at the beginning, at least, once again, the labs really showed what the causation was, and saved time and me not attempting to do a bunch of cognitive behavioral therapy for something that I can't unfortunately change, enlarged ovaries with cysts. So yeah. You want to keep rolling?
Go ahead.
Okay. So kind of transitioning, just some maybe tips. Follow the collection instructions explicitly. So if you decide, hey, I want to order some labs through my doctor, or maybe it's actually through LabQuest, and then you're going to have your doctor analyze those, make sure you read the instructions. I'm thinking of someone in particular that read the instructions and it said, okay, collect the urine midstream. Got a little anxious, asked the nurse. The nurse said, oh, just go for it. And then the sample ended up not being accurate. So just make sure if you have any questions, ask obviously that lab technician or whoever is helping you get the labs that you're clear on the instructions. You don't have to redo them or have some unnecessary concern because they weren't accurate, unfortunately. Know what labs you'd like to request to be ordered. So, hopefully with today's discussion, we can provide some assistance with that, but also, to have these kind of conversations with your providers and try to, be as educated as possible to advocate for yourself and be inquisitive. And then the next one, have an organized list written down of your problematic symptoms. So, your provider, has limited time, unfortunately, and, maybe is, having a quicker schedule that day. I do think that this can be kind of helpful if you kind of streamline, hey, these are the main things that I want to address, especially if there's more than one. So maybe, just keep something super handy on your phone or whatever, so you can streamline that appointment and, maximize the time with the provider as much as possible. And lastly, I have known research and also have other, females besides myself say sometimes we're not taken as seriously about our ailments. So just again, be assertive, you know what you're experiencing. So the more you can be organized and intentional about how you want to use your time with the provider, and obviously having good rapport with them. I think that's super important to make sure you are comfortable with your providers. I think that, goes a long way in getting what you need. And lastly, okay, so we have the labs collected. Now what? I know everybody knows this, but I just had to put it anyway. Don't Google to interpret your own lab results. I know that might be tempting, but again, as Dr. Ron was mentioning at the beginning, what is low or high, normal, that really does vary as we're going to hear for race and gender. And also, let's say you're someone who is, really conscientious about your nutrition, working out, you're training for something, so there is stress on the body. Or just in general, maybe you're someone that you want to be super proactive about your body and your health. I think that's important to communicate to your provider, and won't be very clear if you Google of saying like, hey, I have this lab that's low or high, and I'm someone that's, super healthy and actively exercise. Like, I'm looking more for what's my optimal level, not just normal. And, maybe also to be conscientious of kind of the norm that your doctor sees. So, if they're, typically healthy people don't go to the doctor other than hopefully their annual checkup. And so that might be a matter of perspective of, that you're maybe not the most common population per se, especially like I said, we talk about like athleticism or something like that. So, again, having that good rapport, the provider of saying like, okay, this is what I, how I feel about my health. This is what I do, and my intentions about those. So I just say, yeah, normal range can vary. Have your lab results in a safe, handy place. So I know that, hopefully you can upload those into your client portal, but if you got your lab somewhere else and you're having your provider look at those, if you're relying on maybe their Wi-Fi being, secure and easy access, that might be difficult and not use your time most efficiently with your provider. So one suggestion, maybe just screenshot your lab results, put them, on your Google Drive or your albums on your phone. So that way you can quickly access them if your provider's like, hey, I don't have time to go in the portal, or, you had some difficulty or for whatever reason to be able to do that. And last we kind of talked about this one already, just being clear and about how proactive you'd like to be and having that, ongoing dialogue with your provider. And lastly, okay, so we've done all this, we got the labs, we know what we're gonna do, what they recommend. Don't forget to ask when you should come back and retest. Don't assume that just because they said, hey, you need more zinc or this medication, whatever. Like before you leave, you're like, hey, when should I come back? So you don't retest too soon. And then that was kind of pointless. The effect of whatever they had recommended wouldn't have occurred in the body. Or again, you kind of feel like, oh, I guess I take this forever. And that also might not be a great idea either. So just make sure that you ask and get their recommendations to follow.
All right. Do we? All right. How are we going to do the questions? You want to read them to us, Alexandra?
So the first question.
Are you guys able to hear her questions? No. Oh, you're going to have to just talk into this.
Maybe I should just read. Okay, so we're going to go through the chat box and look at those questions. And so feel free to add to the chat box or, raise your hand and speak up, but we'll get through these questions first. And the first person asked, where is a good place to get this blood work done for kids and adults to make sure they are being read correctly and get fixed?
Okay, then you can do it. Well, I mean, if you have an established provider, I think that's great. If let's say, we're doing multiple comprehensive labs, I know that you can go to LabQuest and for the most part, order some labs. You're still going to need to get that interpreted. And I think from my knowledge that I'm not sure there's someone there that can interpret. So you would still need a medical doctor to interpret those, but at least you could go ahead and get blood and urine work through that venue, LabQuest, diagnostics, and any of those. Yeah. Dr. Ron, you want to add to that?
No, I think that's great. I know that was your area because you've just been through all of this. Let's see, did it start at the top? Mistletoe.
Oh, yeah, that's the one we just answered.
Okay, all right, let's keep down. I can read that just as well. How do folks know what types of tests to ask for? Well, when we're doing a normal physical, they're going to run the normal test, and they probably won't run a thorough thyroid panel on you. If there's fatigue involved, it might be a good idea. If there's, you can tell in hyperthyroidism compared to hypothyroidism, they can both have fatigue, but two different presentations. But again, the full thyroid panel would be possibly indicated. That's what we're trying to educate you guys about right now. If it's a female and you suspect that there may be something wrong with the hormones. I've seen so many young females that hadn't seen have not done their first OBGYN appointment yet. I think parents should really, really, really think about doing this sooner than later, especially if there's a lot of mood swings going on and everything else. Hormones are critical. Do be advised that certain hormones can make females worse in regard to their presentation. So there are some, that's widely accepted out there. So you have to know about that. Urinalysis, if you live here in Houston, I would probably always want to do a check for mold, check for microplastics. These are all things that would be toxins, need to be ruled out. We actually found one child with lead poisoning from an old house in Galveston that still had lead paint that was used in it. So, think about your situation. Is there any possibility that there is mold growing in your house? Was it flooded? Think about those kind of things. And that's where the more education we get to the providers out there to say, did you think about this? When did this start? The onset? Well, we just moved into this new house for us. Okay, well, that's a key right there. So it's hard to decide, and that's why we're trying to do this the best way we possibly can. Those are the basic ones that we would want to see. Of course, the CBC and the metabolic panel are going to all talk about this as well. Good place to get work.
This one, the next one. Someone asked, before acting on the result of the lab, should they be retested to confirm the accuracy? Yes, that's a very good point. It doesn't hurt to retest, make sure that if it does say again that it's low or high or abnormal. Something I read too, which I didn't realize that we were talking the other day, is that the normal range is based on the area that you're located in. So, for example, if you had labs and you maybe lived in, Minnesota or Colorado, where there's altitude, you might want to have the labs retested if, you're in Texas for long term or something. That they do fluctuate. I don't know the variances of that in depth, but I did have a medical provider tell me that. So yeah, absolutely. I mean, sometimes mistakes can be made, whether it's on, like Dr. Ron said, the delay of it when it was analyzed or issue, or, the person providing the urine sample, their blood work, didn't follow instructions.
For your first case, would another solution have to be that the child be outside for more sunshine? Yes, I have a theory behind why inflammation is such a problem with us in the United States. It's a worldwide problem. Rheumatologists it's driving them crazy. No matter what they try, they can't get your markers down. And people have fibromyalgia, they've got arthritis, they've got this and that and the other, and it's just a constant struggle. But I think what has changed is that over the last, in regard to sunshine, in the last 150 years, we primarily became inside creatures. And according to Darwin, it takes 14 generations for us to adapt to a new environment. And we haven't been 14 generations since we've been inside creatures. So now we're even more inside creatures since we've been through COVID, and we're seeing a whole lot more of anxiety, depression, ADHD. We're seeing a whole lot of vitamin D deficiency. And so can we get it? Well, if they say the recommendations is if you can get out into the sunshine and get the full sunshine on your head and your body without sunscreen for the first 20 minutes, then you can put the sunscreen on. Because if you wear a cap and you put sunscreen all over you, you're not getting it in. Just makes logical sense. We can treat melanomas from sunburn, but we can't, it's so hard to treat this other stuff. I do think that vitamin D supplementation may be needed. That's something to talk over with your doctor. But okay, what's the next question? It actually is. What's that?
Oh, keep scrolling down. state only medical providers. Here in Texas, you can. I mean, I just recently ordered lab work for myself, and then, oh, sorry, someone else who is ordering labs. So in the state that they're in, only medical providers can order labs. At least for my experience in Texas, I recently ordered labs and then had my physician interpret them for me and give recommendations. And I went to LabQuest just down the street in my neighborhood. But yes, I mean, clearly it's not every state are you able to do that.
Next question. My experience, mold exposure isn't actually picked up in blood tests. What are some of the options? Well, like I said, I was talking to Dr. Michael Pierce about this, and he said actually urinalysis is a good way to check for mold, more so than blood tests, which is great to know. And people ask, should I test my home? I said, well, it would be smarter to test yourself. And if it's in you, then start checking where it came from, whether it was your home or whatever. But if it's not in you, maybe you don't have to test your home, because that can be quite costly. Next question here, will you be able to rank and order the labs that are coincide with specific symptoms from your database? Would this be Rosetta Stone for psychophysical disorders? That's why we put this together, where, you know, if you get a set of labs and it's a little low and you go into it, you can find out where the physical symptoms and psychological symptoms, how they express themselves. This is why we put this together. Everybody could do this research themselves. It would just take, you know, it took 4 of my research assistants 2 months to come up with all this stuff. So it's a pretty deep dive into it. But no, I like being able to provide this for people. It's something everybody needs. Next question. What about the reduction of human biome due to early exposure to antibiotics? Eric, you want to elaborate?
Yes, I mean, it seems that the biomes now seems to be linked to a number of cognitive or behavioral problems, at least contributing. And if I look at our culture, at least, that almost none of the children today have a, quote, normal, traditional human biome, because they have already been attenuated early on because they had earaches or whatever, and they got antibiotics. They had cesareans by their mother. All those would vary that, plus for many of them, I would say our horrendous diet, in a sense, that does not promote, which is the part which came up earlier about polycystic ovary disease, which is not cysts, but it's basically incomplete eggs who are just frozen in their development, which also seems to be linked to the diabetes. And that's, again, all lifestyle and diabetes, which is the part you're talking about time and time again. So it seems for some of the people, you know, somehow, how can we improve that? I don't know the answer. That's, you know, so I'm looking for.
No, and I think that's something very valid when you talk about cesarean births. The reason why children are so fragile with their immune systems is because studies have proven time and time again that cesarean births that do not get the start of the mother's bacteria from the vaginal delivery, they don't start their immune system. They don't get all that stuff that they need to. So it may be more convenient or less painful or everything else. But the docs out now that are starting to introduce that into the child's mouth at the same time they do the cesarean are doing much better with their immune systems, because that's where we get it from, is from our mothers.
There's one more interesting piece, which maybe, and that is that as children get fevers, we often suppress the fevers with medication. And from a classical conditioning perspective, we are doing classical conditioning of the immune system not to activate fever, which means we really don't allow the immune system to mature.
Exactly right. And, you know, I found out about this years ago. And the purpose of fever is to raise the body temperature to the point that the organism trying to invade you cannot survive. Yes. And so if we stop that fever, we're stopping our natural body's process to be able to do that. So being the male traditional guy that, well, if that's what it is, as soon as I start feeling sick, I'm going to the sauna and I'm going to get myself as hot as I can, as fast as I can while I'm still healthy. And let me tell you, that has really helped knock out my diseases a lot quicker. I can't do it when I'm sick, but once just start to feel it coming on, I'm going to help create that higher temperature. And it really does help, you know, so just a sidebar. I don't recommend that for anybody else out there, but I had to test it on myself and it seems to work.
Well, there's a whole treatment strategy called hyperthermia, which you do it. And in fact, it's much more than just only the fever. The fever also activates the other functions of the immune system. Mm-hmm. So it doubles almost the immune activity.
Right. We just need more sweat lodges around, right?
I'm ready.
Run outside in August. Urine.
Exactly.
That'll do it.
The vitamin D going and everything else. Right. All right. What else do we have here? We'd be able to rank in order of labs that are coincident with specific symptoms from the database. Yes, but if you go through the database and you should be able to link these things together. We're going to try to build this into the app actually, so it's more automated. But yes, I mean, you just got to throw them through the pages, I guess.
I think we're done here.
Okay. What test is used for the MTHFR test variant?
Yeah. Empowered, yes.
Okay, they Alexandra attached that on a lab you can order. It's just a simple cheek swab to test for the MTHFR gene variant. And it's, you know, there's controversy over people testing for it, but I've been working with the MTHFR gene and with supplements for this for the longest time, since 2009. And I've seen a tremendous improvement in people's symptoms by addressing this one gene here, especially in regulating their mood and anxiety and sleep. So it's something critical that we should look at and we should know. And it's about a third of the population to 40% actually have this gene. I have this gene, so I'm really near and dear to it. And I have been on the supplement since probably 6 or 7 years now. And my eyesight for distance has gone back to 20/20 because it does affect your eyesight. I asked my doc, I kept having to change prescriptions. She said, you don't need glasses for distance anymore. I said, how can that be? I'm pushing 70, you know? She said, it just happens sometimes. We'll find out. It was really the supplement was making up for that folic acid that I didn't have. And there's a test for that as well. So, and 2 of my brothers wouldn't take the supplement. I sent them a case each and they were a bunch of country idiots. And they didn't use it at all. And sorry about that, guys. They're laughing at me over here, but they are. And both of them had massive heart attacks. One's had 2 open heart surgeries. The other had a lot of stents in it. And I haven't got any heart issues. So it's like writing's on the wall. You know, we need to know about this stuff. What were you saying the next one is?
Oh, I think this person was saying, yeah, you're right. Someone had posted that even sometimes for some people being outside, their body's still not able to effectively convert sunlight to useful vitamin D. So yeah, luckily there is a supplement and, you know, the doctor can advise. So that's a very good point. Being outside doesn't work for everyone. Yeah.
Thank you, Robin. Glad to see you here or hear you here. Eric, let's see. I can believe that. It said recently a pediatric neurosurgeon told this person that 90% of his patients he tests in Houston come back as vitamin D deficient. That's astounding. I totally agree. And when you really think about it, my gosh, what should Seattle be like? I mean, you're talking about, or England, it would be toxic. And a lot of times it is.
Well, Ron,
Yes,
I think it's almost the same, because if you look at people living in Texas as a group, they would be in the whole summer, they're living all indoors in air conditioning. And so in fact, the exposure is almost less. And then the other factor is if you have older skin, it's much less efficient in transforming. Also, people of color are much lower, have much more lower efficiency from an evolutionary perspective as well. And finally, almost every patient who died of COVID had unbelievably low vitamin D levels.
interesting.
Wow.
I'm taking my vitamin D. I tell you.
Yeah,
that.
me too. I went right back to eating. Yeah.
All right.
I think I must run too much outside.
No, I spend a lot of time outside in the summertime because I love it by the water and So, what supplement are you talking for the MTHFR gene? Yeah, the supplement, you can take Deplin, which is a prescription, which is a methylfolate. They make Orthomolecular makes a methylfolate specifically designed called methyl CPG. I like it because it's made in labs that are FDA approved here in the United States. So we don't have any arsenic in it, and they test the raw materials, and then they test the going out supplements to make sure they have in there what they say they're going to have in there. And but any questions about that, you guys can email me later. Alexander will put our emails up here, and I'll be glad to help you. This is not an infomercial. I don't do infomercials. Okay. All right. Let me see.
Maybe keep scrolling down.
Keep going down. Okay. There's a contact. Any comments on ferritin levels? Sometimes it's low because the body is storing to prevent infection. Any idea on the ferritin?
I'm not sure I know too much, but Eric, I think tell me more. It sounds like you do though.
You're muted, Eric.
I don't know. It's more a question. I once came across it that for some people, if you get infections and if you look at the body sometimes as a mechanism withdraws the iron as much as possible because bacteria to grow need more iron. And so it's a part of our immune system way to try to control infection, paradoxically. That's why. So but I don't know that mechanism well, so that's why I was asking.
You know, and iron deficiency and everything else and even as you lose blood, as I did and many females go through, when you lower your hematocrit and your red blood cell count and everything else so low, the fatigue is massive. And we were talking about this the other day, weren't we, about iron? And little Miss over here is a pescatarian and eats fish only. And so we had this big discussion about fish and about could she have enough iron in her.
And I do, people. He's trying to convince me to eat more eat red meat. And but again, I'm not suggesting or recommending to each his own. That doesn't work for everyone. But we were having this conversation because
you were a little low though.
Yeah, but it was okay. My doctor said, no, I don't have to convert me.
So she was saying, I'm not going to eat red meat. I said, well, why don't you use an iron skillet? And
There
you
you
can do good cook.
There you go.
Just cook your food in that and get a little bit of iron that
There
way.
you go.
So
I do take an iron supplement. Yes, you have to be very strategic, of course, if you're going to have that rigid of a diet. But yes,
we keep each other on our toes, that's for sure. But no, any other questions out there? Hogan, glad to see you here, Dr. Hogan. She's from the East Coast.
Oh, okay.
Hold on, that's your answer. That's your answer. Red meat. Robin, don't do that to me.
I'm here. I'm listening.
Hogan's a psychiatrist from the East Coast. She's been a pleasure to be around and have discussions with and doing so much good work up there on the East Coast. What are your thoughts from a medical perspective, since you're the psychiatrist?
I think it's great that you're doing this, and I always pick up something, learn something, because I feel like most psychiatrists are so busy that it's easy for us not to be up on something new that somebody else is doing. And for me, especially the integrative approaches. And I'm glad you're talking about vitamin D. I feel like when we have so many patients with obesity, it's very hard to get the vitamin D level up. I grew up in Mississippi, and all I ever heard was just go out in the sunshine. And then during COVID, all these researchers are saying, you know, if you live north of North Mississippi, you probably can't get the vitamin D you need. It takes 2,000 to maintain yourself where you are. Another 1,000 for every 10 below your target. And the integrative people are saying the target is 50, not 30, right? So that's a lot of vitamin D. I take it every day, you know, and I wish I had more to offer, you know, but I think y'all are doing a great job.
Well, what do you think about the concept of turning this to an app for all the treaters like you? Psychiatry, we get these cases in, and I'm sure you've had many cases where when you did order labs, you went, wait a minute, look at this is not right.
Right. Right. Yeah. I think I missed the very beginning, and so I'll put a note in there so I could hear the beginning. I don't know what your app is going to be, but if you have cases or suggestions about labs, I think that's a great resource.
Well, what the app's going to be, we created a table. It's about 30 some pages long of each of the lower high readings that we normally come up and find. And then
Okay.
what's their psychiatric presentation, and then what's their physical presentation, what's their cause of this issue, and then what's the appropriate referral.
That's
Because
wonderful.
we kick this back to the MDs because this is outside our area. But, you know, for parents out there, or for any adult that goes and gets labs and not quite feeling right and gets referred automatically into psychiatry for anxiety and depression, wait a minute, let's take a good look at their labs first, because we're supposed to do that, correct, Hogan? On diagnosis, you got to rule out medical causality.
Right. And but unfortunately, if you send people to their primary care doctor to rule out medical causes, they often don't do very much. And it's the integrative doctors that are going to do the most. And every once in a while, it'll be the odd doctor or the psychiatrist that picks up something. We all got to sort of cross cover each other. So I think if the neurofeedback people can start showing a reputation for thoroughness, that will help our whole field, and we need to help each other get there.
Exactly. And so that's why I say, if we publish this and then we get the app going, it's going to give you a lot of information that you can't normally get. Then you can pressure docs, say, hey, I know my thyroid's in the low normal range, but could we not try something because I can't get out of bed, you know? And
Yeah.
you know, you won't have to have the issue of trying to give them a stimulant or a Wellbutrin.
This psychiatrist had that conversation with her primary care provider, and she was not interested in the least. And then, you know, I read about giving myself, you know, getting my doctor pushing harder and getting some thyroid. And it said, well, you can suppress the thyroid and it might forget how to make thyroid, and then you'll just need more supplements. And so it's like, okay, how important is it? Am I tired enough? Am I just getting old? What else? Do I go see an integrative medicine person? I'm not going to draw blood on myself. You know, we've got to all work hard to cover these bases and see what happens. You know, a little bit of thyroid supplementation can go a long way. And how to decide which one gets it? I fight with doctors all the time to just give my patients thyroid hormone when they're high normal in their TSH.
Mm-hmm.
Or to let me supplement them, even though it's going to totally suppress their thyroid.
Right. I don't know.
Thomas Kelly is a great resource. There's a book by a guy called Thomas Kelly on high dose thyroid hormone for bipolar depression. It's worth knowing about. It's a great book.
Well, that Dr. Jekyll and Mr. Hyde, the way the thyroids present is perfect for answering that. So I think that's a great way to look. Can you put that book into the text so people can?
I will. And psycheducation.org also has a lot. If you don't know about that, that's a psychiatrist that does a little. It feels like he does more than most psychiatrists with light therapy and other things. And he's the one that talks about Thomas Kelly's approach. So I'll put that in. Yeah.
I appreciate it. Thanks so much, Hogan. Good to talk to you again.
Good to see you.
Well, we're coming to the end of this time. I'll turn it back over to Miss Alexandra.
Okay, so if you have any other questions, I put our contact information in the meeting chat, and you can send us those emails if anything comes up. As far as future dates, our next presentation is going to be April, sorry, it's loading.
19th, I'm pretty sure.
Thank you. Yeah, April 19th. It'll be Wednesday at the same time, 12 to 1. And our next discussion will be going over the the autism, looking at the research, and we'll have a guest speaker, Dave Gaines, with us to speak. So hope to see you all there. The registration will be out soon. Thank you everyone for joining. I hope you'll have a great day. Stop the recording.
Yes, stop it.